Depression has been recognized in human beings since the early ages, before modern medicine existed and drugs became available to treat it. The definition of depression has changed dramatically from the days of ancient Greece up until now, as have the therapies used to treat or manage depression. An ancient Greek physician named Hippocrates defined the human body as a mixture of 4 humors: blood, phlegm, yellow bile, and black bile. A person with depression was thought to have an extra dose of black bile in their system. In the Dark Ages, it was thought that depression was a punishment from God, or that depressed people were possessed by demons. Then came the Renaissance period, where depression was almost glamorized as a gateway to creativity, as many great artists were thought to have depression. In the 17th and 18th centuries, religious definitions of depression were replaced by scientific ones, although it was the responsibility of the patient to maintain their mental health. The spinning technique was also developed to make people dizzy in order to rearrange the brain to fix depressive symptoms. Then, in the 19th and 20th centuries, surgical procedures called lobotomies were used to destroy the frontal lobes of people's brains to calm them, but often this procedure led to personality changes, coma, or even death. Finally, in 1952, it was found that a drug used to treat tuberculosis called isoniazid seemed to help treat depressive symptoms in patients. At this point in history, scientists began looking to drug therapy as treatment for depression. In today's world, depression is thought to be caused by many factors, including physical, mental, and social influences. It often takes many different healthcare professionals working together to treat depression in their patients. Depression is now recognized as a disease, but it's different than simply feeling sad. We all feel sadness at some point during our lives, but that doesn't necessarily mean we are depressed. To be diagnosed with depression, a person must have either depressed mood or loss of interest, in addition to at least 4 other symptoms such as weight gain, fatigue or loss of energy, trouble sleeping, feelings of worthlessness or excessive guilt, trouble concentrating, agitation, or thoughts of suicide or self-harm. These symptoms must last for at least 2 weeks straight in order to be diagnosed as depression. Fortunately, depression can be treated using cognitive behavioral therapies, medications, or a combination of both. Cognitive behavioral therapy involves talking with a therapist to recognize where feelings of depression come from and why, and to set goals for patients to change the way they think and act in the world. Using both treatments together has been shown to be more effective than either treatment alone. Antidepressant medications work by increasing chemicals in the brain called neurotransmitters. Neurotransmitters are responsible for sending signals in the brain, and when these chemicals are too low, mood can decline along with them. The 3 main chemicals are serotonin, dopamine, and norepinephrine. People who are depressed may have decreased levels of 1, 2, or all 3 of these chemicals in the brain. There are different types of antidepressants that increase the activity of these 3 chemicals to varying degrees. One class of antidepressants are called selective serotonin reuptake inhibitors, or SSRIs. These are among the most effective and commonly prescribed antidepressants today. These drugs prevent serotonin from being absorbed back into brain cells, so it lingers around longer to activate brain pathways that regulate mood. These drugs include paroxetine, fluoxetine, sertraline, citalopram, escitalopram, and fluvoxamine. SSRIs can cause nausea, trouble sleeping, decreased libido, headache, and bowel changes, but most patients tolerate them well. Another class of antidepressants are called serotonin norepinephrine reuptake inhibitors, or SNRIs. These drugs prevent both serotonin and norepinephrine from being absorbed back into brain cells. They have similar side effects to SSRIs, but tend to cause less sexual dysfunction and weight gain. These drugs include venlafaxine, desvenlafaxine, and duloxetine. Norepinephrine is a chemical that is also involved in the fight-or-flight stress response. Since these drugs increase its activity, they can also cause high blood pressure and an increased heart rate as side effects. Another class of antidepressants are called the tricyclic antidepressants, or TCAs. These include drugs like amitriptyline, imipramine, doxepin, clomipramine, desipramine, and nortriptyline. TCAs increase the activity of serotonin and norepinephrine in the brain to improve mood and increase alertness. These drugs have been around for a long time and are effective at treating depression, but their use is limited by their nasty side effects like increased heart rate, weight gain, low blood pressure and dizziness, dry mouth, and memory impairment. Bupropion is an antidepressant that increases the activity of dopamine and norepinephrine in the brain. This drug doesn't cause the usual side effects of sexual dysfunction and weight gain like many of the others do. It can cause greater sensitivity to seizures as well as decreased appetite, which is why it cannot be used in people who have seizures or eating disorders. Bupropion is a good drug for people with depression who constantly feel tired because it causes more wakefulness as a side effect than other antidepressants. Mirtazapine is another effective antidepressant still used today. It indirectly increases specific serotonin activity in the brain by a different mechanism than the other antidepressants to regulate mood. Mirtazapine is one of the most sedating antidepressants and also causes the most weight gain. However, it is useful and effective in certain people who experience trouble sleeping or eating because of their depression. Finally, one of the oldest classes of antidepressants, called the monoamine oxidase inhibitors, or MAOIs, are used as a last resort only if other antidepressants have failed. They work by preventing the breakdown of serotonin and dopamine in the brain by the enzyme called monoamine oxidase. These drugs, such as phenelzine and tranylcypromine, are reserved for hard-to-treat depression because they can cause serious side effects due to interactions with other drugs and certain foods. The takeaway message is that depression is a condition that can be treated just like other diseases such as diabetes and heart disease. Although we still have a lot to learn about the exact mechanisms of depression and why it happens, we have many treatment options to choose from, and many people are living highly functional, happier lives because of these treatments. For more information, please email Steve Bond at sbond@urichpharmacy.com.